Hi, my name is Dr. Emily Kocurek. I'm a physician at UAMS and I take care of adult patients with lung problems and patients who need to be in the intensive care unit. I'd like to tell you today about my grant proposal entitled Implementation of a UAMS Pulmonary Embolism Response Team, or PERT, with expansion to a statewide Arkansas Pulmonary Embolism Response Telenetwork. I've invited my family to help me make this video because I'm doing this work for them and Arkansans like them. This is my Aunt Kathy, my Aunt Mary, my cousin Lindsay, my cousin Kara, and my Aunt Kim. Okay, guys, I've told you a little bit about my project, but I know you have more questions, so please ask away.
Emily, what exactly is a pulmonary embolism?
So a pulmonary embolism is a big word for blood clot. We call it PE for short. These kinds of clots form in the legs and then can break off and travel or embolize into the lungs, where they can cause life-threatening problems. They can clog up the blood flow in the lungs and cause dangerous low blood pressure, heart failure, and critical problems with breathing and oxygen. PEs are a medical emergency and require immediate attention.
So how common is pulmonary embolism?
So we think there are about 900,000 clot events in the US every year. It can occur with elderly patients, cancer patients, and hospitalized patients, but it's really almost any person's disease because almost anybody can be affected. It's the third most common vascular cause of death and may exceed deaths due to strokes and heart attacks.
How do you treat a PE?
Well, as you can imagine, decisions have to be made really quickly because patients can become very sick. There are a lot of treatment options, ranging from blood thinners to clot-busting medicines to procedures that vacuum out the clot. And it requires a lot of different kinds of doctors being all coordinated to help in the care of the patient. This includes ER doctors, radiologists, and ICU doctors, to name a few. All of this is very important, though, because if PE is not treated correctly, patients are 5 times more likely to die.
So tell me about this thing you call a PERT.
So PERT stands for Pulmonary Embolism Response Team, and it's a team of PE specialists. When a PE is diagnosed, the PERT is activated with a phone call. The PERT leader gathers all the information about the patient and then convenes a virtual meeting to discuss the best action. The team makes a recommendation, and then the plan is explained to the patient for their consent. Then the treatment is arranged by the team as quickly as possible.
What is happening to patients in Arkansas right now who suffer PEs?
So right now, UAMS does not have a PERT, and mortality rates for PE are the highest in the South. They're also highest in Black men and women, which is the state's largest minority group, and in rural settings. In fact, in Arkansas, more than 30% of all counties do not have a local community hospital, so access to rapid, specialized care for PE is limited. We plan to create a PERT at UAMS with the eventual goal of offering the PERT via telehealth to all Arkansans. Through an internet call, PERT can recommend appropriate treatment locally or a rapid transfer to UAMS if needed.
How will you create a PERT at UAMS?
So we're going to do some interviews with UAMS providers who participate in PE care and take their feedback and present it to an expert panel. The panel will then use this information to design the PERT. We'll use feedback from users of the PERT on what changes should be made, and we'll review the cases treated by the PERT to make sure patients are getting the best care.
How will the project expand the PERT across Arkansas?
So UAMS already has programs in place for stroke, trauma, and high-risk pregnancy that allow patients to be assessed virtually at outside hospitals. They're run through UAMS Institute for Digital Health and Innovation. We're going to ask experienced individuals at the Institute for Digital Health, as well as representatives from Arkansas community hospitals, to help us determine how we can best deliver the PERT virtually to the state. Thank you guys so much for helping me explain this project today, and thank you to my listeners for their attention.